Hello everybody and welcome to this webinar. My name is Janet Walker and I'm the chair of the British Association of Social Workers International Committee, and the Commonwealth Organisation for Social Work is leading on this, but it's being hosted by BASW, and we're looking at issues of migration of social workers, experiences and learning. To start, I'm delighted to welcome Silvia Daisy Romanos. Dr. Romanos has been the chair of the Commonwealth Organisation for Social Work since September 2020. She's an associate professor of Madras Christian College in the Department of Social Work and has been associated with MCC since August 2007. She enjoys working with social work practitioners and academics. She's a member of several advisory boards and is especially committed to the promotion of the interests of marginalised tribal communities. She's published more than 20 research papers in national and international journals. Silvia, thank you.
Thank you, Ms. Janet. Good morning, good afternoon, good evening. Warm greetings and thanks to the attendees for the time to attend this webinar titled Migration of Social Workers, Experiences and Learning, organized by BASW, the British Association of Social Workers, the Diaspora Special Interest Group, COSWA, Commonwealth Organisation for Social Work, and the Madras Christian College. Migration is not new to human society. In the past, humans moved from one place to another for search of food and safety. This migration never stopped. It continued for various reasons. Even today, people migrate from one country to another to avoid poverty, to seek employment, and to enjoy a good standard of living. Even though there are more benefits in migration, leaving one's own place, state or country is little painful. This may be due to differences in climatic conditions or culture. Hence, a smooth transition is required in migration, and acquiring knowledge about the same, learning necessary skills, imbibing values, networking with good people, known people will be helpful in making a smooth transition. In fact, in post-COVID, we find many prosperous opportunities for migration, and it is at the right time BASW, COSWA, and MCC have organized this webinar. Sincere appreciation and warm welcome to Ms. Janet, Chair, Dutran and Priya David, co-chairs, BASW Diaspora Special Interest Groups, members, Dr. David, COSWA main representative, and Mr. Ramesh, and all the other board members of COSWA, the dignitaries of Madras Christian College, and the executives of IFSW, IASSW, and other Commonwealth organizations. I take immense pleasure in welcoming the panelists of the webinar. We have eminent speakers from different parts of the world. Dr. Prince Anadurai, Associate Professor, Madras Christian College, India, Ms. Titilayo, Nigeria, Ms. Annalicia from Barbados. Warm welcome. Warm welcome to the social work practitioners and professors. Hearty welcome to the youngsters, the student community who are eagerly waiting to listen to the panelists. We are very pleased to be able to welcome those of you that have been with us for a long time, as well as those who are new to this association. We are excited to have you here. This will be an opportunity for us to learn from each other and grow together. Welcome all. Let us create a peaceful and sustainable future for all. Welcome, dear one.
Many thanks, Sylvia, for those warm words of welcome. We're going to start shortly with our keynote speaker who is recorded her talk, Liz Beddoe from New Zealand. We'll then move on to various other speakers who will talk about leaving your home country and also arriving at a new country. Of course, if you've got any questions at the end, for the end of the session, please would you put them in the chat, and we'll pick up on them at the end of this session in our question time. So I'm very delighted to welcome Liz Beddow. Professor Liz Beddow is a professor of social work at the University of Auckland in New Zealand. Her research interests include critical perspectives on social work education and supervision, social work professional identity, student hardship in social work education, social work and reproductive justice, and the experience of migrant social workers. Liz has published widely in international journals and edited books, addressing diverse professional issues. She co-edits the only book on migration and social work, as well as several books on the practice of professional supervision. Liz is editor-in-chief of the journal Aotearoa New Zealand Social Work. Thank you.
Good afternoon. My name's Liz Beddow. I'm a professor of social work at the University of Auckland in Aotearoa, New Zealand, and I'm delighted to be joining you today in this pre-recorded talk. I wish I could be there in person, but it doesn't work out very well for me in terms of the time frame. But I was really pleased to have the opportunity to talk about this research, because it's been work that I've been involved in for quite a significant, probably more than 10 years now. So it's a real pleasure to be part of this very valuable webinar happening today. And I wish I was able to be present in person, but I hope to be able to see the other presentations in due course. So I'm going to talk about the some of the research that we've done in New Zealand, and I bring greetings from Aotearoa, New Zealand, from my colleagues and in the School of Social Work in my university, and particularly from my colleagues who've been involved in this research for a number of years. I wanted to start the talk with just a very brief background to our project, and then talk about some of the ways that this developed over time. The first, I guess, we were motivated to start the project way back in probably about 2011, when we started to collect some information anecdotally about the experiences of migrant social workers in our country. We then did an analysis of the breakdown of information that we got from the registration board on the social workers who had overseas qualifications, and then used that to start a project where we did a survey and also did some interviews with migrant social workers, so we were able to get some breadth and depth of information in our first the first part of our research. We then went on to do a sort of number of different elements of the project. My colleague Alan Bartley did some research in Australia. I interviewed some social workers from New Zealand who were practicing in the United Kingdom. And then we were joined a bit later on by a colleague, Shaji Peter, who was involved in a further series of focus groups held in New Zealand. And at the end of the slides, I've got a number of our publications that if people are interested, they can follow up on that. Fairly early on, we made some connections with King's College, with Jill Manthorpe and with Shireen Hussain, who were doing some work in this area. We joined the research network, workforce mobility network, that King's College hosted at that point. And what we observed over time was the growth of this topic as an international research focus, because it was clear that there were many migrations of social workers across the globe in both directions, both from the southern hemisphere to the north and from the northern hemisphere to the south. And so this created a really interesting potential for international connections. And for us, probably as a research team, while we still have an ongoing interest in this topic, it culminated in the book that Alan Bartley and myself edited, which included contributions from many of the people from around the world who were kind of involved in this research at this particular time. And that was published by Policy Press in 2018. So we I wanted to kind of talk a little bit about the challenges reported from the research, and then finish off today by looking at what are the remaining challenges, what's the agenda for action, particularly the role of professional bodies, and what's the agenda for future research in this topic. So I'll start this off with a quote from Shireen Hussein's contribution to our 2018 book, and where she talked about the search for better opportunities, how how social workers sort of navigate the maze of global and social mobility, and social workers who become transnational, who transfer to another country, bringing their skills, their knowledge, their wisdom, have variable experiences of this social mobility. And I think there's some themes that have come across all of the different research that's been done. So Shireen talks about this, the cornerstone in the debate, particularly in the mid, the 2015 to 2018 period, was the transferability and development of skills and training from one context to an international context, where social workers moved not just once, but often more than once. I met people who had practiced social work in 2 or 3 different national contexts by the time I met them. And so people are mobile, they are moving around and developing their skills in different contexts. And every sort of transfer that they make from nation to nation, they gather new skills, new knowledge. And so I see them as being an incredibly valuable resource for our profession, though inevitably as researchers we find elements that need that kind of demand some problematization of these experiences and the way we welcome or don't welcome people to new contexts. So the very nature of social work is about assisting people who are maybe vulnerable, making sure that our practice is culturally sensitive, and we do have nation-specific practice. I mean, earlier work talked about, the challenges. I mean, Karen Lyon's work talking about the challenges of finding a sort of international social work when we are so culturally determined and so nation specific in the practice, and that's often driven by the particular communities that we engage with in social work and the demands of particular populations for services that are sensitive to their needs. So the team that kicked this off with me, Alan Bartley, my colleague, Christopher Shea, who's a colleague in the University of Auckland, Shaji Peter, who joined us for a few years at the University of Auckland and now is in Australia at Edith Cowan University. And Alan and Shaji and I and a couple of other colleagues, Lynn Park and Wendy Chu have just recently published, actually literally just today, published another article based on our research. So it's a team that has had people join it and do some work with us and then move on. But we retain a sort of a network of researchers in this area and good friends as well. So the kind of themes that came up in our research, which I'm going to talk about fairly briefly, but I just wanted to kind of introduce these themes because I suspect they'll come up again over the course of the webinar today. And to some extent, I've kind of focused them around these 4 ideas: that strengths and struggles, which is in the title of one of our articles; enduring dislocation, again; more recent work that's been done in different contexts by Karina Moderman and my colleagues at the University of Auckland, Barbara Staniforth and Helene Connor, looking at the cultural context in New Zealand, the bicultural practice that concerns social work practice in a country where we have our Māori Indigenous population. We have a largely Anglo but increasingly diverse settler population, and what that context means for practice, and how new arrivals in social work in New Zealand negotiate that context. And finally, I want to talk about a little bit about our duty of care to transnational social workers. And that includes thinking about how we do the registration and licensing, how we recognise the skills and qualifications, and how we do the induction. So a quick tour across these issues. I'm just keeping an eye on the time because I've been told, as always, there is a limit to the time available for these webinars talks. So strengths and struggles, we highlighted migrant social workers' really fervent desire to have better access to information and induction. That's an enduring issue. That hasn't gone away. We also noted their experience of discrimination in the workplace. We did find that social workers who are people of colour did meet racist attitudes in the workplace, unfortunately, and that was something that we chose to address in various publications and in some presentations to try and encourage a much more welcoming approach to migrant social workers and what they brought, rather than problematising them and seeing them as being a challenge for us to deal with. We argued that we needed much better orientation and induction activities and much more welcoming system of recognition of migrant social workers' skills, and that is echoed in the work of others who have done research in this area. Enduring professional dislocation, this was a significant theme in our study, where we found that social workers felt that social work in Aotearoa New Zealand was very different to social worker in their home country, and that's been echoed in the work of Australian researcher Karina Modeman, who interviewed a number of social workers from, I think, mainly from the UK and Ireland, who came to Australia to practice. Again, that kind of echoing of that dislocation that comes from social work, which we think of as an international profession, being very different in particular contexts. So we advocated for this, this need to ensure that we practiced a kind of induction that really introduced people to the cultural context, as well as understanding the more typical things that happen, which is we tell social workers about the laws in our country or the policies in our country, when what we found is what people wanted to understand was the cultural context. Refer also to contributions by our Canadian colleagues who are researching in this area, Marion Brown and colleagues, and I've got the references for these at the end. The third theme, which I've hinted at, I guess, a couple of times, is understanding the new culture, or cultures perhaps is better, learning about the historical development of social work, thinking about the rights of Indigenous and racialised populations, minoritised and marginalised populations in the host country, and how well we do that. And both Modeman and Staniforth and Connor, Modeman in Australia and Staniforth and Connor in Aotearoa New Zealand, have published on that particular issue, the needs, the kind of the consideration of how well we prepare new colleagues in our countries to work with Indigenous or other racialised populations. We also talk about a complicated welcome, and again I refer people to the Canadian colleagues' work in this area, and also Angelika Papadopoulos' her work from 2018, where both groups looked at the sheer complexity of negotiating recognition of qualifications and achieving professional licensing and or registration in the new context. And I really liked the way Brown et al. Called this a complicated welcome, because often social workers who have migrated to a different country to practice have been invited to come. There have been various movements in both directions, north to south, global south to global north, and vice versa, where we have had shortages of social workers in particular contexts, and governments in particular have reached out to social workers, inviting them to travel to a new location to practice social work to meet the needs where there have been shortages. And we know that this happened in New Zealand It's happened in Ireland, it happened in the United Kingdom. And what we found was the welcome was complicated because it was, please come, we desperately need you, we'll pay your airfares, maybe support your relocation, help you with all sorts of aspects of relocating. But then you're kind of pretty well on your own in terms of the lack of cultural induction. And our colleague Shaji Peter did some work on this, and actually we published an article where we compared the way teachers and nurses were welcoming new practitioners who were transnational practitioners with quite complex and free and easily accessible training and induction to develop the new context, where in social work we found very little evidence that that was happening at that time. We now kind of frame this as a duty of care, that as professionals, as professional social workers, it behoves us to really think about what kind of welcome we are offering our new colleagues, and we believe we can still do a lot better. The call for a much improved induction remains. We need to bring an intersectional lens to the experiences of our colleagues and do better to understanding that often these migrations of our colleagues across, particularly global south to global north, are part of a continuing impact of colonisation, or the sort of structural impact of economic changes, changes in the mobility of workforce. So we need to think about that context, not just thinking, here's a new face, how quickly can we get them up and running and doing the work and helping us meet our targets in our agencies. So we see that as an ethical issue. It's a duty of care to do better for our new colleagues, and we still believe that we as a profession are falling a bit short on this and can do much better. And I think you'll find in all of the literature, even some of the more recent stuff, which we haven't really talked about today because of time pressures, that you'll find there is that sort of sense that we can do better than this kind of complicated welcome, with which has quite mixed experiences. We can do much better than we have been doing. So the future agenda, I think there's a lack of research on the experiences of service users and working with their transnational social workers. It's tended to be that we focused on the transnational social workers themselves, their supervisors and managers, employers' perspectives, maybe to some extent the perspectives of professional bodies, but pretty well missing in this picture is the experiences of service users. The other thing that I've identified here as a future agenda is the need for policy work. How can we use our international bodies, both our national professional bodies in our countries, but also the international bodies? How can we tap into that sphere of influence to improve this? Because it may well be something that can be an international program of development rather than us all tinkering in our own country contexts. So I think I've used up my, let's have a look, I've used up my my time allocation. So this is me. I can be contacted at Auckland University. I've got on the slides at the end of this presentation, there are 3 slides of publications that are relevant to my talk. I'm more than happy if someone emails me, I can provide the details of those publications and provide a copy of the slides. So thank you very much for the opportunity to present today. I'll just stop sharing my screen, and if I can get to that point, right. And I will hope that you enjoy the rest of the seminar today, and hope to be able to catch up with some of the presentations in due course. So thank you again for the opportunity to meet with you today, and good luck for the webinar. Thank you very much.
Thank you. A big thank you to Liz for taking the time to make a very thoughtful and very interesting talk. Questions are beginning to come in the chat or comments, so just remind you they're really important to us and do inform our current kind of conversations. I'm delighted to move on now to invite 3 speakers from India, Africa, and jointly from the Caribbean, Canada, to talk about their experiences of leaving your home. The first speaker will be Dr. Prince Annadurai. He's worked as an associate professor in the Department of Social Work in Madras Christian College for 29 years. He's trained in the International Office of Fudan University, Shanghai, China, and the Counseling Center of St. Olave's College, Minnesota. He's been a visiting faculty in the Appalachian State University in America and in the National Institute of Epidemiology in Chennai. He's teaching public health. He's worked with the government of India and national and international bodies, and is an editorial member of the Indian Journal of Health Social Work and the Journal of Madras School of Social Work. His interests include public health, social work research, clinical social work, adolescents, youth and families, and gerontological social work. Quite hard to say, I apologise. A big welcome to you, Prince. Thank you.
Thank you very much, madam. In the globalized era, migration is inevitable. The participants, those who are here, and the dignitaries, the number of countries you would have visited or you are going to visit in the days to come, it will be exponential. Even as a social work professional, I have visited more than 15 countries in my tenure as a social worker. So migration in terms of employment or for higher studies, it definitely will be on the rise. So this paradigm we need to understand. So migration is inevitable in the globalized era. My presentation, I would like to put it in 3 headings. Why do people migrate? Reason, it could be for the personal reasons. The second thing could be for professional reasons. The third thing for geopolitical reasons. All put together, I can say there are push and pull factors. Let us discuss about the personal reasons. I'm talking about these reasons from Indian perspective. People migrate for better salary, because if you are in a developing country or underdeveloped country, what you get as a social worker, if you are not in a qualified, professionally qualified organization or job, what you get is pittance. For example, I know there are some social workers, my good friends, they are working for a very meager salary, but they are doing such a wonderful work, high quality work. Then for better quality of life, this better salary and better quality of life are interlinked. If you want to migrate to other countries, this is one of the push factor, because you want to have a good quality for yourself and as well as for your family, and especially for your children. You want to have a good quality education abroad. You use your social work education, social work experience for migration, and also for family. For example, better health insurance are there, better health coverages are there, and better social security measures are there for families and for children if you migrate and settle as social worker abroad. In the host country, another important personal reason is lack of respect and dignity as social work professional in the home country, because you are considered as one among other profession, since you do not have any professional bodies or association to govern your job regulations. Then mismatch between your educational qualification, skills learned, and also the nature of work that you are involved in. I know there are some of my colleagues with PhD qualification working in meager salaries. They work day in and day out, but what they get is very, very less. It's like hand-to-mouth existence. Sometimes people may work for organizations, not for job satisfaction. They may have the passion to work in a particular field. Maybe they are interested to work with children or with the marginalized communities or with the tribal communities. But since they are not getting into jobs according to their qualification or according to their passion, they are forced to work in certain organizations. What happens? They are working for those organizations, but not for their passion or not according to the skill set what they have. These are some of the personal reasons. Then for professional reasons. In India, as of now, we do not have professional bodies to register or to regulate or to accredit or to license the profession. Of course, there are bodies, but we do not have the patronage from the government like Medical Council of India or Nursing Council of India or Dental Council of India. So the professional practice is always a serious problem. Then lack of professional standards. Since we do not have professional bodies, this leads to lack in the professional standards. For better job opportunities, people they migrate. This could be another professional reasons, because social work is widely accepted and it is in high demand in Western countries rather than India. It is a joke, not to offend anyone. In some Christian churches, sometimes altar calls are made. How many of you want to go and work as missionaries in different parts of the world? Many people will raise their hands. If the countries are announced like we want missionaries to work in America or Europe or South American countries. But if the clergy says that we need people to work in sub-Saharan countries or some poor countries, there may not be much people to go forward. The same thing happens in social work profession also. Why do people migrate? If you ask another question, where do they migrate? They want to migrate to some greener pastures like African, more rather than African countries. They want to go to US or to Europe or to some other countries like Australia or New Zealand or Canada or Ireland. So if you see the migration pattern which is happening as of now, people want to go for greener pastures rather than going for challenging countries. For example, if you are working for UN refugee, in such case, if you want to work in war-inflicted regions like Afghanistan or Sri Lanka or Sudan or Nigeria, there may not be more takers for that. They also have better job profile, professional wise. They have better opportunities for career development. They also have better work environment. Well-defined work timings are there. 8 hours work in the sense that is highly defined. But in our home country, if you want to work, sometimes you need to burn your midnight oil, hours together, days together, night together to finish a particular job, since we do not have professional bodies to control the work and work timings. And also lack of support from the superiors and other team members. And in many social work institutions and organizations, if professionally qualified social workers are not there, how they treat their colleagues in a very unprofessional way. Then we do not have continuous educational opportunities, like how we invest. We have continuous educational program to hone up our talents and skills, and also to learn the new trends and technologies in social work paradigm. Then opportunities to participate in policy level platforms and governance. That is another reason why they want to migrate. For example, I know Commonwealth Organization or British Association of Social Workers. You people have better network with the government and also policy level paradigms. It's easy for you to work with the government and make changes in the policy level situation. Such type of participation at government levels and as well as in the policy level, that is lacking in developing countries, many developing countries, including India. If you see the geopolitical reasons, many want to migrate because they want to get a green card. I know one of my students here, immediately after finishing his degree, he got married to one nurse in the US. She was already having a green card. He told that was one of the best way to get migrated to US. Then less patronage from the central and state governments. If they are not creating job opportunities, it's very difficult for the social workers in India to get into highly qualified jobs with more pay.
1 minute more, please, Prince.
I will be finishing. It's the last slide. I know one of my colleague who visited Michigan University recently. He said in that Michigan University, there are more than 600 social workers. And also in countries like India, where discrimination, caste discrimination or gender discrimination in workplace, when it is rampant, they want to go abroad to escape from such hard realities. Other important things related to geopolitical reason, foreign contribution regulatory acts. So the government very strictly come with this and also with stringent measures for funding to NGOs. So organizations like Greenpeace, World Vision, Compassion in India, they were shunned doors because of certain policy regulation by government of India. Where in India, the social work is linked to charity more than professional social work. And sometimes it is considered as a foreign profession since it has its roots in West. And issues like Indianizing social work, where people think that we need to have Indian theories, Indian approaches. So these are the three reasons I would like to share. For this migration, is it possible for all? No. So people with the cross-cultural competencies alone can migrate, or people where can get adaptability or easily adaptable to new situations and migrate. So with this, I would like to conclude. I would like to thank my students, Vandana Varghese and Lloyd Dawa Parai, who helped me in this preparation. Once again, thanks for this wonderful opportunity.
Many thanks, Prince. Thank you for your insight and your views as well. If we can move on, and I'd like to introduce Titileo Tade. Titi lives in Lagos State, Nigeria. She's a member of the Association of Medical Social Workers of Nigeria, and she's been co-chair of the Conference Planning Committee for the Lagos State chapter since 2017. She's currently Deputy Director, Acting Head of the Department of the Medical Social Services Department at the Lagos University Teaching Hospital in Idi Araba. Titi lectures at the College of Medicine and in the Department of Social Work in the University of Lagos. Welcome, Titi. Please go ahead.
Thank you so much. Good afternoon, good morning, good evening, everyone. Thank you so much for having me here. It's a pleasure being here. I've been asked to speak about why why professional social workers are migrating, specifically social workers based in Nigeria, from out of Nigeria. migrating to other parts of the world. Obviously, I've been practicing for about 22, 23 years, and I've practiced in a teaching hospital. I also lecture, so I've come in contact with a lot of social workers, students, and obviously there are a lot of anecdotal reasons that I have come in contact with people as they tell me why they're leaving the country. But today, I decided not just to rely on my experience. What I did was I carried out a small survey amongst professional social workers. Please note that what I'm going to discuss next is will be focused on people who are already practicing. I don't think it will speak for social workers who are fresh graduates who are about to leave school, that are just starting their careers. These are people that are already practicing. So I carried out a short survey amongst practicing medical social workers in Nigeria, Lagos, but not Lagos, across the country really. And we had 50 responses. And if you look towards the screen, you would see that I've isolated the top 3 factors for reasons people would like to emigrate. And we, like the previous speakers have said, emigration is something we can't stop. It's historic. It's something that's always been happening. And most of the time when people emigrate, it's because they're moving from a place of lower resources to somewhere they feel that there'll be higher resources. So maybe it's food, maybe in terms of income, in terms of just personal, improving their quality of life, their top personal well-being. So that reflected in the responses I got. So the top 3 factors that came out from this, and also coincides with a lot of what I spoke to social workers about when asking them about why they're immigrating, was 1, they're immigrating for better work conditions. So the thing is, they believe the work conditions we have in Nigeria are not ideal for what they want to do. It's not ideal for the practice set for them. The practice setting isn't ideal for them, and they would like to move to countries where the quality of, they will get conditions that are more favorable to them, and they will feel appreciated by employers about what they do. That's hacking back to what Prince said about people feeling that they're undervalued in the country, about the type of work they do. The second important thing for them was better life for children. Most people traveling not just for themselves, but because they're looking at their children and they're looking at the fact that we want to make a better quality of life for our children. We want them to do, most parents want their children to do better than they have. And they feel that if they remain in their countries, if they remain in Nigeria, they won't be able to give the children the opportunities. So they emigrate. The third factor was better employment opportunities. So in Nigeria, yes, even though we have social workers practicing, the opportunities are not many. I think most social workers employed are employed in Lagos State, which is the former capital of Nigeria and where I reside. We have more social workers practicing in the medical field in the country than in most areas. It is picking up. Last year, we were finally recognized as a protected profession in December 2022 when our president signed our bill. So there are a lot of struggles that we are still facing as a profession. And a lot of people are just thinking, let's travel to places where we feel the profession is better established. And it's just a lot easier. And there are many other job opportunities than what we have here in Nigeria. So there are different other things that people have talked about. Insecurity in the country. If you follow our country, we know we've had issues of insecurity in the past few years. And then also better healthcare. They would travel out of the country to access better healthcare for themselves and for their children. Now, those are the reasons that people would emigrate. Now, my survey also looked at what challenges people feel may occur if they emigrate. And some of the people that responded to the survey were people who had already emigrated. Now, I know they're already in the UK, in the US, we have some people in Canada as well. So some people had responded. Now, the top 3 factors, note that I mentioned that even though I said top 3, there are 2, I mentioned 2 because we have a tie. somewhere. So the first thing is the fear of unknown. You're moving to a country you don't know much about, you've never been it for most people. So there's fear of the unknown. Then there's the culture shock. So first and foremost, for us as Nigerians, not speaking specifically as Nigeria, we have a culture where even in the work settings, we don't call people who are your immediate superiors, you don't call people who are older than you by name. You call them by titles, you call them Mr., Mrs., and doctor or whatever. And one of the biggest things that we got from survey and anecdotally is the fear of, wow, if my kids move, they're going to start calling everybody. I can't imagine a 10-year-old calling a 60-year-old by name. That looks a bit odd. So the issue of culture shock, names and titles. Nigerians are a generally proud people. Let me quickly say this, and I'm going to mention the reason why when I get to discrimination. We're generally proud people, so we are very particular about certain things, about behaviors. But one of the things they mentioned that would shock them is interacting with people in the community, LGBTQI community. We do have communities and the LGBTQ community in Nigeria, but they're quite small communities. They're still under the radar a bit because the law in Nigeria is against homosexuality and certain things. So the communities aren't exactly well established in the country. So you have these situations where a lot of the social workers who are traveling have not worked with people in the community. So that's, for them, it's a huge shock. Gun violence was something they also mentioned, especially for those traveling to North America, the US, where there's a culture of people being allowed to have weapons. So there's fear of gun violence. And they've, some stories about social workers being attacked in their places of employment because of decisions they've had to make. There's a fear of loss of culture for the children. My children will lose touch with our culture. They will lose touch with things like calling their elders auntie, uncle, and all those kind of things that's there. And then the discrimination, and I'll link this back quickly to what I said about Nigeria being generally proud people. Most of us West Africa, and I'm speaking of Nigeria and West Africa now, because we're a relatively homogeneous society, we remained, we've had a lot of Western influence, yes, but we don't have a lot of foreigners living amongst us. So a lot of Nigerians don't understand or don't see this discrimination. We talk about it, they're worried about it. One of the biggest fears is standards. And usually by the time they understand that they were discriminated against, there's a lot of anger. So I'm going to get back to the next.
Mute myself. Hi everybody. It seems there's some sound problems there. I'm sure that Titi is joining us from Nigeria, so it's a long way to come. But perhaps in the meantime, we'll move on if that's okay. And hopefully, Alicia for Skeet is still with us. If you want to put your camera on. Excellent, thank you very much. Annalika is a registered social worker and psychotherapist with the Ontario College of Social Workers and Social Services Workers. She's been living in Toronto, in Ontario, Canada now for the past 2 years, but grew up, I think we can safely say, in the beautiful island of Barbados. Annalika is currently employed as a cognitive behavioural therapy clinician with Across Boundaries Mental Health Services in affiliation with the Canadian Mental Health Association. In a role, she provides psychotherapy services for residents in Canada, and specifically those who identify as Black, Indigenous and people of colour. Annalika's interests include and are not limited to culturally sensitive trauma-informed practice, research, knowledge, translation, health policy, and care accessibility. And Alika, we offer you the floor for 5 minutes to talk about your experiences.
Thank you so much, Jeanette. And it's lovely just to be here and just to share this space with all of you lovely people. I'm seeing people here from across the globe. So just thank you for taking the time out to just coming here and sharing with us. So just getting right into it, because of course I only have 5 minutes. And this, these are just perspectives from the Caribbean, basically migrating from the Caribbean to, a North American country, not only from myself, but from many other colleagues. We've been engaging in such dialogues for let's say the last year, for the last 2 years, right? So in terms of reasons why we may even consider or want to move, I think Dr. Prince and Titilio mentioned an extensive list, right? And that list does not exclude the Caribbean. So for instance, one of the 2 main things that I can really talk about are the professional reasons as well as the personal reasons, right? So for the personal reasons, many people may want new experiences, many people may want change, many people may want better opportunities, right? But from a professional standpoint, especially within the Caribbean, understanding the population sizes, where I come from in Barbados, it is 166 square miles, which is kind of small, right? So when we think about how many people are graduating every year with an associate's degree or even with a bachelor's or a master's degree, it does not compensate for, the amount of social work opportunities that we actually have within the Caribbean. So many times people who want to migrate, it is because they want to continue to practice in social work. Because many a times when people graduate, if they're unable to find employment within the social work sphere, they end up doing something else, right? So many of the times, again, people, migrate because they want to have that opportunity to practice in an area that they do enjoy and that they do love. Another part of it is the ability to specialize. Within the Caribbean, what we see happening from the associate degree level up to the master's level is more a generalist social work type of practice. So there's not a lot of opportunities to specialize in different particular areas that are needed. So whether you are, let's say, a new student or someone who's been employed for a long time and you want to expand your network or expand your net worth, you may consider, it is probably best for me to just move in order for me to get and identify and engage in these types of opportunities that the European countries or maybe even the North American countries can offer. Another part of it is regulation. In the Caribbean, we don't have, especially in Barbados, there's not any type of regulation regarding social work. So many people, especially those who would have graduated with a social work degree or even practicing social work, there's less value, right? And, and it's even worse so when anyone can just come up and do something good and call themselves a social worker, not understanding the amount of work and time and energy that we have to put in, not only to complete our degrees, but even to work in the particular areas and offer our skills and our knowledge and our expertise, right? So that value is diminished. Now, another part of it is ensuring that, when people are like in the Caribbean, there's also a lot of, we talk about nepotism too, because even though that you may have a social work degree, let's say, or you want to specialize in a particular area, you want to work in a particular area, because the Caribbean is so small, it's about who you know or who knows who. And many times, there's a subsection of people who end up getting left out. Yeah, so those are some of the biggest and main reasons why people in the Caribbean may think about moving or may actually move. Now, let's move forward to when they do move, what are some of the dilemmas? So there are different dilemmas based on where you're starting from. I saw some people in the chat already start talking about the perspectives from as a student, right? And there are also perspectives from people who are coming in with 20 plus years of experience. So let's talk about students. So let's say a student newly, coming to the country, maybe they're going, maybe they're coming to Canada or they're going to another country to specialize in a particular area of social work. Now, the dilemma there that happens is you're literally sent, or you're literally in a culture now where you have no knowledge about, right? You're doing courses and you're going to classes that you may never even knew from before. You're in spaces where people do not even look like you, so you may be treated differently, you may be discriminated against. So there are always these type of micro issues that we do not necessarily address, but needs to be addressed, right? And I believe that that's sometimes the start of a lot of stressors for students coming in, right? As well as for people who may just be not just coming in to go into a school, but coming straight from, let's say, their 20 or 10 years of experience, and just going straight into a workforce. So acculturation to the host country is a big deal. And when we think about our skill sets and the type of work that we do, we must understand the social systems in which we operate, right? And we must understand the people in which we serve as well. And sometimes to do that, it takes time, right? Because there's no one there to tell us, there's no one there to sit and say, okay, this is where you have to do this, this is where you have to do that. So you have to take a lot of time to navigate those social systems, to understand those social systems. So for even employers now, and what is something that, we've been talking a lot about is employers who may be hiring migrant workers. This is something that they don't necessarily understand. So even in the onboarding process, there's no information regarding, the plethora of social systems and how we can best serve the clients that we're there to help. The second thing is fair compensations. Now, initially, like a lot of people, again, we probably would have moved for a better quality of life, but what does that look like, right? Because if we're moving from a country where, let's say, the standard of living is lower, right, as compared to another country, how are we kind of navigating this? How are we ensuring that we're fairly compensated? Right? So how are employers ensuring that we're fairly compensated, and how are you as potential employees ensuring that you are fairly compensated based on the standard of living in the country that you're actually heading to, right? The other thing is company policies. What are the company policies that, exist that can help or protect migrant workers? And when I say protect, I mean protect from discrimination, protect from harm, right? Because when we're going to or we're migrating to other countries, sometimes we may not be aware of some of the policies that are there, or sometimes some companies may not do a good job in terms of letting us know what our rights are in terms of policies. So we not only want to learn how to advocate for our clients, but how can we advocate for ourselves without fear of retribution, without fear of being retaliated against, without fear of discrimination. The next part of it is migration policies. What are the migration policies that employers and employees must be aware of that can affect our practice? Because one of the things that I've seen a lot of people experience is that even after they're migrated, and let's say you've been employed with a particular company, you don't realize that there are other migration policies that could be affecting you or restricting you in that particular role, or even from moving or from shifting, whether it's from one company to the next. So we must be aware of what are these migration policies, what are these company policies that may be restricting us or may be harming us or may cause issues, right? And I've seen a lot of this coming up with a lot of workers here, where now there's a lot of advocacy in relates to migration policies, because even if social workers are migrating, what ends up happening is some employers are not necessarily letting employees know like the full extent of how they will be protected. So even if they work for a year or 6 months or even 2 years, after that particular time, it's almost as if they can be easily disposed of. So many people have gone back to their home countries because of miscommunication between the company policies and also the migration policies. And as a result of these particular things, whether it's a fair compensation, issues or dilemmas as it relates to acculturation and acculturation to the host country, right? The underlying thing that ends up happening is exploitation. And this exploitation then, because either employers are not providing the information that we may need to know, or maybe we also need to do the amount of research that we need to have in order to migrate or transition smoothly, you know, exploitation can occur. And because of this exploitation, and for me as a person who not only specializes in social work, but specializing in mental health, these impact, you know, a lot of our social workers, psychosocial, spiritual, professional, personal lives, right? And as a result, we see a lot of social workers, we see a lot of migrant social workers who, you know, may have initially come in with big smiles and feeling really excited, but then within maybe 6 months, they're burnt out, they're stressed, they're not able to cope, right? Because of all of these different dilemmas that they have to end up navigating themselves.
Brilliant, thank you. If that's okay, if I can stop you there, if that's okay. Thank you very much for your contribution. I'd also like to say a big thank you to Prince and Titi as well. And of course, we can see how their narratives are very much building on what Liz has said. If we can move on, please, to look at arriving in another country. Specifically, we're going to look at UK. And Priya and Duke are going to take us through their presentation. Priya is a doctoral researcher and experienced manager with 16 years of leadership in children's services. And Duke is a registered social worker. He's also the co-chair of the BASW Diaspora Special Interest Group and co-chair of Equalities, Diversity and Inclusion Advisory Group of the British Association of Social Worker. Sorry, got the S at the end. If I can just give a little bit of a context for what they're going to say about the UK. We employ around 122,300 social workers in the UK, of which 99,000 are in England. We've had for well over a decade a shortage of local social workers, leading to increased recruitment of international social workers. Around 10% of the English workforce of social workers is from other countries, with people who qualified in other countries being highly represented from Australia, Canada, from South Africa, India, Zimbabwe and Ghana. And as we already seen, transitions are often more complicated than people assume. So if I can hand over to Priya and Duke, that would be brilliant.
Thank you, Janet, for that. Thank you. So good afternoon all, and it's been really useful to listen to all speakers from all over the world. And I think it'll be useful to hear, to give a little bit of a personal context of how the special interest group was formed and how we came to be. So my name is Priya David. I'm the co-chair of the Diaspora Special Interest Group. I came to UK nearly 19 years ago from the Middle East, though qualified in India. And I was, as all of you have said, excited about the development opportunities here in UK. But it didn't take me long to realize that I was thrown into a highly stretched child protection service in UK, while I had very little experience of safeguarding work. My first year was a true baptism of fire, with little to no support available to meet the humongous needs of moving to a completely new country. Both culturally and legislation-wise, it was very different. It took me nearly 10 years before I stumbled across an Indian Association of Social Workers group, who were formed recognizing the importance of having peer support from overseas social workers who were facing similar challenges like me, and much more actually. So it soon became very clear to me that this issue needs to be recognized by the authorities here, who are recruiting in great numbers, as Janet has already said. This resulted in me joining the International Committee of BASW and raising this issue as a need, that needs due attention and work. With the commitment of the chair then, Dr. David Jones, and other committed colleagues in the committee, we moved on to this we pushed this important agenda forward and set up the special interest group a year and a half ago. So the British Association of Social Workers is a special interest group formed for overseas social workers here in the UK. And our aim is to advocate for the voice and interest of diaspora social workers here. We aim to promote best practice standards for the recruitment and retention of diaspora social workers, and also promote the development of support networks for diaspora social workers here in UK. However, we needed to be evidence-based. We saw a lot of surveys, but we thought it's important to take a survey of the of social workers here, overseas social workers here in UK. And we did a survey in May 2021. And I'm just going to, next slide, please. Yeah, thank you. I'm just going to quickly summarize, due to lack of time, some of the key challenges expressed and some recommendations made by our participants, that UK social work system can learn from overseas recruit. So to start off with, the three most important issues that came up were: one, 73% respondents found that induction on arrival and professional orientation was the most challenging. And this was followed by 43% finding post-appointment mentoring and 42% finding management support to be challenging. At least 50% of the respondents felt that local support network for members of their own country needs to be addressed. With regard to relocation advice, only 35% found relocation, including visa support, having worked well or was helpful to them. And with housing and accommodation, only 26% answered that assistance with finding accommodation and practical arrangements were helpful. Thus, we noted that the challenges for overseas social workers remain the same regardless of the long history of social work recruitment from abroad for UK. So through this survey, the participants also made some useful suggestions as to what UK social work can learn from overseas social workers. 65% of them suggested the need to utilize more of the community support, followed by 54% suggesting advocacy service, 51% suggesting project management. So these are just a quick, summary of our quantitative data. So I'm going to hand over to my colleague and co-chair Duke Tran to speak about the qualitative experience and what the special interest group is currently doing. Duke?
Thank you, Priya. So I think it's worth returning to what individuals have said to us. These are presented here. Only a third week in the country, and I was given a full caseload of complex child protection cases. And to safely protect vulnerable adults and children requires time, experience, and understanding of local norms of the society. Some managers had failed to understand and empathize with the difficulties of adaptation and adjustment, making comments like, "Feel free to go home if you don't like this place," is clearly unacceptable. It is difficult to get rental property at times without a year's rental or employment history, and equally difficult to open a bank account without a permanent UK address. Also, members had experienced delays in family visa approvals and difficulties in getting their children into local schools and registering with local doctors and services. Next slide, please. Clearly, we can learn from these experiences to improve the recruitment practices of employers and the lives of their staff. What we have learned is that recruitment starts from home countries where unbiased and transparent information should be presented to ensure that overseas social workers are fully informed before they make the decision to migrate. Once here, staff should be encouraged to attend local support groups and national diaspora networks to share their experiences of settlement and practice in safe spaces. Workplace training should also focus on promoting cultural understanding and cultural competence to address ignorance and discrimination, and this must include understanding of their social workers' cultural identity, as well as the understanding the cultural context of their practice. With the support of the British Association of Social Workers, Priya and myself, with the Diaspora Special Interest Group, we are working in developing a common induction standard for UK recruiters and employers, which we hope to launch very soon. We want to see smoother clearance and registration processes from our government regulators and more research in this field and evaluation of recruitment programs. Next slide, please. And finally, if you are interested in what we are doing, come join us at our next network event on the 28th of April, where we will be discussing workplace support, staff networks, advice and representation, and how to get it. Thank you.
Many thanks. Thank you, Priya and Duke. We're coming now towards the end of our session, and perhaps I could say firstly a very big thank you for all our speakers in contributing to what is a really interesting topic and often very complicated. And I think everybody's expressed the kind of push-pull factors that often lead to people arriving and choosing to arrive in other countries to practice as social workers. But I think it was Liz that talked about the complicated welcome that they receive. And certainly Priya and Duke, I think your research and your points have very much added to those issues of complicated welcome. But I think I have seen, trying to follow the chat at the same time, and people have also talked about some of the areas that it would help them and the areas that we could add to in terms of supporting social workers who migrate to other countries. And some of that has been related, for example, to the work we do with student social workers and their opportunities to learn more by, for example, placements in other countries. But also, we talked about, somebody mentioned a pre-migration training course. So that would orientate people much more to some of the opportunities and challenges that do very much exist. I hope you found that useful. Thank you very much for your coming to this session, very much so. Just invite if anybody has got any last comments to make, that would be helpful. So thank you. Yes, David, please.
Janet, I think Ramesh has got his hand up.
Yes, he has. I apologise, Ramesh, I didn't see it. Please.
Thank you, Dr. David and the organizers. Just want to add, this migration is not just the issue between countries. It's also an issue within the country and within the state also, where I come from, India, where language, culture, customs, and the religion and the race, and there's a lot of other challenges also I see. So finding a way out using this kind of conversations, is a good way forward. And I have worked with many students who traveled from other parts of the country where, I'm from, and they share the similar challenges like, all of you mentioned. And even within the state, I have seen a challenge between somebody moving from a rural or a tribal location to a city with whatever the details that, we have discussed. I think the similar challenges they face. I think this kind of supportive groups like, BASW has, I think we should promote that kind of group at every region and every country. Thank you.
Ramesh, that's really helpful. And I think I would absolutely agree. Often, even just moving in the UK between different countries, the UK has its challenges very often for everybody. So thank you very much, everybody, for listening to what we have to say, and thank you for the discussion. David, please. I think you're on mute, David.
I am. Thank you, Janet, for chairing, and thanks to Ramesh, who's a member of the Commonwealth Organisation board. And perhaps I could just say, Janet, that COSWA will be having further webinars during the year. We will be having a series on regulation of social work in different Commonwealth countries, and this will address some of these issues. But if people are interested in this subject, we can certainly come back later in the year. But thank you to all the speakers. I'm sorry time is tight, but that is what the life of social workers is like. I think we always have to watch the clock. Thank you.
Thank you, everybody. Have a good afternoon in the UK, at least, or a good evening. Bye. Bye.
Thank you, everyone.